Chapter 75. Persistent lower back stiffness deserves more attention than most people give it. If your lower back feels stiff almost every morning, you're certainly not alone. This is one of the most common complaints among adults over 75. The good news is that understanding the possible causes can help you make informed decisions about your health. Point 1. Stiffness that limits independence. Lower back stiffness becomes more concerning when it starts affecting everyday independence. If getting dressed, climbing stairs, preparing meals, or performing household tasks becomes increasingly difficult, it's time to pay attention. While these changes are often blamed on aging alone, persistent stiffness may be related to conditions such as muscle weakness, osteoarthritis, spinal degeneration, or osteoporosis. A proper medical evaluation can help identify the underlying cause and determine whether treatments, such as physical therapy, exercise, or other interventions may improve mobility. Addressing the problem early can help older adults maintain their independence and reduce the risk of falls. Point 2. Talk to your healthcare provider. If lower back stiffness continues for weeks, becomes more severe, or starts interfering with your daily activities, it's important to talk to your healthcare provider. While many cases are related to normal age-related changes, persistent stiffness may also be associated with conditions such as osteoarthritis, spinal degeneration, osteoporosis, or muscle weakness. A proper medical evaluation can help identify the underlying cause and determine the most appropriate treatment plan. Seeking medical advice early may improve your mobility, reduce discomfort, and help prevent the condition from becoming more limiting over time. Point 3. Stay physically active. Although resting may seem like the best solution, staying inactive for too long often makes lower back stiffness worse. Gentle activities such as walking, stretching, or exercises recommended by a healthcare professional can improve flexibility, strengthen the muscles that support the spine, and help maintain mobility. Even a few minutes of movement throughout the day may make everyday activities easier and reduce stiffness over time. Point 4. Good posture makes a difference. Poor posture places unnecessary stress on the lower back, especially when sitting or standing for long periods. Paying attention to posture, using supportive chairs, and avoiding prolonged slouching can reduce strain on the spine. Small improvements in posture, combined with regular movement, may help decrease stiffness and improve comfort during daily activities. Point 5. Protect your bone health. Strong bones play an important role in supporting the spine. After age 75, osteoporosis becomes more common and may contribute to back pain or stiffness if left untreated. Eating a balanced diet, getting enough calcium and vitamin D, and discussing bone health with your healthcare provider may help lower the risk of bone-related problems. Point 6. Avoid sitting too long. Remaining seated for extended periods can make the muscles and joints feel even stiffer. Standing up and moving regularly may help reduce discomfort. Point 7. Stretch gently. Gentle stretching performed safely can improve flexibility and help reduce lower back stiffness. Avoid sudden or painful movements. Point 8. Pay attention to balance. Lower back stiffness may affect balance during everyday activities. Taking simple fall prevention measures can help you stay safe. Point 9. Learn to recognize warning signs. While lower back stiffness is commonly caused by age-related changes, there are situations where it should never be ignored. If stiffness is accompanied by severe or persistent pain, numbness, tingling, weakness in one or both legs, difficulty walking, fever, unexplained weight loss, or loss of bladder or bowel control, seek medical attention promptly. These symptoms may indicate conditions that require immediate evaluation. Even if these warning signs are absent, stiffness that continues to worsen over time or significantly limits your daily activities deserves professional assessment. Early diagnosis may allow treatment to begin before the condition leads to further loss of mobility or independence. Point 10. Physical therapy can help you stay independent. Many older adults believe nothing can be done for chronic lower back stiffness, but that isn't always true. Physical therapists can design personalized exercise programs that safely strengthen the muscles supporting the spine, improve flexibility, increase balance, and reduce stiffness. These programs are tailored to each individual's abilities and medical conditions. In many cases, improving strength and mobility can make walking, climbing stairs, getting out of bed, and performing household tasks much easier. Working with a qualified healthcare professional may also reduce the risk of falls and help maintain independence for as long as possible. Point 11. Maintain a healthy weight. Carrying excess body weight places additional stress on the spine and supporting joints. Maintaining a healthy weight through balanced nutrition and appropriate physical activity may reduce strain on the lower back while supporting better mobility and overall health. Point 12. Stay hydrated. Although water alone will not eliminate back stiffness, proper hydration supports healthy muscles and normal body function. Staying well hydrated is one simple habit that contributes to overall physical well-being. Point 13. Prioritize quality sleep. Poor sleep may leave muscles feeling tighter and reduce the body's ability to recover from daily activity. A supportive mattress, comfortable sleeping position, and healthy sleep habits may help reduce morning stiffness for some older adults. Point 14. Small symptoms can become bigger problems. One of the biggest mistakes many older adults make is assuming that gradual stiffness is simply something they have to live with. In reality, symptoms that slowly become more frequent or more severe deserve attention. Waiting months or even years before discussing persistent stiffness with a healthcare provider may allow certain conditions to progress further. Although not every case is serious, identifying the cause early often provides more treatment options and better long-term outcomes. Paying attention to small changes today may help preserve your mobility, confidence, and independence in the years ahead. Point 15. Take action before stiffness takes control. Growing older does not mean giving up your ability to stay active. While some changes in the spine and joints are expected with age, persistent lower back stiffness should never be automatically dismissed as just getting older. Staying physically active, following your healthcare provider's recommendations, maintaining healthy bones and muscles, and seeking medical evaluation when symptoms persist can all make a meaningful difference. By taking action early, instead of waiting for stiffness to interfere with everyday life, you give yourself the best opportunity to remain independent, reduce your risk of falls, and continue enjoying the activities that matter most. Point 16. Keep monitoring changes over time. Lower back stiffness should never be judged by a single day alone. Instead, pay attention to how your symptoms change over weeks or months. Is the stiffness lasting longer each morning? Is it becoming more difficult to walk, stand, or complete everyday tasks? Are you avoiding activities you once enjoyed because of discomfort? These gradual changes can provide important clues about your overall health. Keeping a simple record of your symptoms and sharing it with your healthcare provider can make it easier to identify patterns and determine whether additional evaluation or treatment is needed. Remember, the goal isn't just to reduce stiffness. It's to protect your mobility, maintain your independence, and continue living an active, fulfilling life for as long as possible.